remember like your press conference in the winter when you sent, both of you sent a very clear warning to Quebecers about the backlash of the pandemic and what it can cause on waiting lists for surgeries. I remember like the warning you sent. You were clear. But today, how it is for you that you don't have a plan to present us? You had a framework because you're missing too much information. How it is for you to wait. What basically you're saying to Quebecers, wait and see. We don't have the answers yet, but we're coming with those answers.
But I'll start. One thing is clear, and every province, every country has an issue. We had an HR issue even before the pandemic. We need to realize that. And remember that we can do a plan, but if we don't have the personnel to implement it, we cannot do it. That's reality. I want to be realistic in the plan that we prepare. And unfortunately, not only the situation on the HR side was difficult before the pandemic, we lost a lot of personnel. And we need to get this personnel, for the ones that are still there, we need to get them rested because they deserve to be rested. And when they are rested at the end of the summer, the plan that we'll have designed with them, with the unions, with the specialists, will be a realistic plan. So I agree with you that it's taking time, but we need to have a plan that is accepted and conceived by the personnel. The HR is a big issue for us, and we'll solve it.
C'est ce qui me fait cette conférence de presse.
Doctor?
Perhaps to add to it there, we're taking the summer also to look at all the sectors of activities because they're as Ministre Dubé is saying, they're all intertwined. So, for example, we have thousands of nurses working in centre de dépistage right now. We have to see that's probably not required as much. We can ramp those down. We can take those individuals, reorient them to other areas. There are, as Ministre Dubé mentioned, patients going to emergency rooms with issues that could be seen in family physician offices. Well, we had structured family physician offices to be hot and cold. Well, now with that, and so there was not that much room in the cold clinics to see non-COVID related things. We're going to be closing down those clinics to convert them all into regular clinics over the course of the summer. And so all of a sudden, that's also going to increase capacity. So everything that was deployed is now, it can't be eliminated because we can't think that COVID is well, first of all, it's still here. And we are not, and we have to face the fact that perhaps we'll have the possibility of another wave, so we can't just shut everything down. But we can certainly ramp things down and reorient towards these other types of conditions that for a year and more, we haven't been able to address it like we'd like to.
That's the reason she's the chef. Voilà.